Most common site of implantation, post- posterior surface of the upper uterine segment. Day of implantation, sixth day after fertilization. Placenta formation completion in 12 to 14 weeks of gestation. Main source of fetal energy by glucose, transported via facilitated diffusion. Earliest USG sign of pregnancy is gestational sac, which is seen at 4.5 to 5 weeks by transvaginal scan. Most accurate USG parameter for dating scan is crown rump length in the first trimester. Definitive diagnosis of ectopic pregnancy is TVS showing an adnexal mass with an empty uterus plus beta HCG above the discriminatory zone 1500 to 2000. Drug of choice for medical management of ectopic is methotrexate. Most common site of ectopic pregnancy is ampulla of the fallopian tube. Snowstorm appearance on USG. It indicates complete hydatidiform mole. Weight gain in normal pregnancy is around 11 to 16 kgs, average 11 kilos. Daily iron and folic acid requirement is 60 mg elemental iron and 500 micrograms folic acid. Best time for anomaly scan is 18 to 20 weeks. Drug of choice for gestational diabetes is insulin, though metformin is increasingly used as first line in some protocols. Target fasting blood sugar in gestational diabetes is less than 95 mg per deciliter. Most common cause of maternal mortality in India, PPH, postpartum hemorrhage. Diagnostic criteria for preeclampsia is BP greater than or equal to 140 by 90 millimeter mercury plus proteinuria or end organ dysfunction after 20 weeks. Drug of choice for seizure prophylaxis in eclampsia is magnesium sulfate using the Pritchard regimen. First sign of magnesium sulfate toxicity is loss of deep tendon reflexes. Antidote for magnesium sulfate toxicity is calcium gluconate 10 ml of 10% solution. Definition of preterm labor. Labor occurring before 37 completed weeks. Drug of choice for tocolysis in preterm labor is nifedipine. This is a calcium channel blocker. Steroid of choice for fetal lung maturity is betamethasone. 12 mg IM, 2 doses, 24 hours apart. Most common cause of breech presentation is prematurity. Most common type of pelvis in females is gynecoid. Bishop score components: dilation, effacement, station, consistency, and position. Favorable Bishop score for induction is greater than or equal to 8. Alert line versus action line on partograph. Action line is 4 hours to the right of the alert line. Most common deceleration on CTG, variable deceleration. Variable deceleration is caused by cord compression. Late deceleration on CTG indicate uteroplacental insufficiency. Primary PPH definition: blood loss greater than 500 ml for vaginal delivery or greater than 1000 ml for elective section or emergency cesarean section within 24 hours. Most common cause of PPH is uterine atony. Tone -70% of cases. First line drug for PPH management is oxytocin. Contraindication of Carboprast is asthma. Contraindication for methylergometrin is hypertension or preeclampsia. The four T's of PPH is tone, tissue, trauma, thrombin. Maneuver of choice for shoulder dystocia is McRoberts maneuver, hyperflexion of maternal thighs. Management of card prolapse. Immediate Trendelenburg position plus manual replacement or elevation of the presenting part plus emergency LSES. Ideal time for anti-D administration within 72 hours of delivery for AHA negative unsensitized mothers. Dose of anti-D for first trimester abortion is 50 micrograms compared to 300 micrograms at term. Uterine blood flow at term is 70 ml per minute. Amniotic fluid index normal range is 5 to 25 centimeter. Polyhydramnios definition AFI greater than 25 centimeter or single deepest pocket greater than 8 centimeter. Oligohydramnios definition AFI less than 5 centimeter or single deepest pocket less than 2 centimeter. Average length of umbilical cord is 50 centimeter. Fetal heart rate normal is 110 to 160 per beat per minute. Minimum ANC visits by WHO is 8 visits, previously 4. Screening for HIV or syphilis and HBsAg done at the first ANC visit. First sensation of fetal movement, it's called quickening at 18 weeks in preemie and 16 weeks in multi. Most common fetal malpresentation is breech. Fetal circulation. The highest oxygen saturation is found in the umbilical vein. Ductus venosus shuns blood from the umbilical vein to the inferior vena cava. Fetal hemoglobin has a higher affinity for oxygen than adult hemo-HB due to poor binding with 2 to 3 BPG. Amniotic fluid volume peaks at 34 to 36 weeks, approximately 800 to 1000 ml. Renal function. Fetal kidneys start producing urine at 10 to 12 weeks. Lung maturity. Measured by the lecithin by sphingomyelin ratio greater than or equal to indicates maturity. Surfactant produced by type 2 pneumocytes starts at 24 weeks, peaks at 35 weeks. Engaged head when the widest diameter biparietal diameter passes the pelvic inlet. Station 0, the level of the ischial spines. Internal rotation usually occurs at the level of the pelvic floor. Levator animuscles. Crowning when the maximum diameter of the head stretches the vulval outlet without receding. Ridgens maneuver used to control the delivery of the head and protect the perineum. Brand Andrews maneuver used for controlled quad traction to deliver the placenta. Mauritius Melee weight maneuver for delivering the aftercoming head in a breech. Burns Marshall maneuver breech delivery where the trunk is allowed to hang to use gravity. Twin to twin transfusion syndrome occurs only in monochorionic twins. Most common presentation of twins, both cephalic. Lambda sign is also called twin peak sign, indicates dichorionic diamniotic twins. T sign indicates monochorionic diamniotic twins. Acardiac twin trap sequence occurs due to deep artery to artery anastomosis. Cervical circlage, McDonald or Shirodkar performed at 12 to 14 weeks for cervical incompetence. Spalding sign. Overlapping of fetal skull bones seen on X-ray or USG 2 to 3 days after fetal death. Roberts sign. Gas in the fetal large vessels or heart, early sign of fetal death. Stalworthy sign. Fetal heart rate slows when the head is pushed into the pelvis. Bandel's ring. Pathological retraction ring, a warning sign of impending uterine rupture. Covillar uterus. Occurs in severe abruptia placenta, blood extravasates into the myometrium. Most common cause of first trimester abortion, fetal chromosomal anomalies, specifically autosomal trisomy. Most common trisomy in abortion is trisomy 16. Most common infection causing congenital anomalies, cytomegalovirus. Most common cause of indirect maternal death is anemia. Most common operation in obstetrics, episiotomy, though LSS is the most common major surgery. Most common site of episiotomy is mediolateral. Battle to placenta, marginal insertion of the umbilical cord. Velamental insertion is cord attaches to membranes, vessels run unprotected to the placenta. Vasa previa is called fetal vessels crosses the internal os, characterized by painless bleeding plus fetal bradycardia after rupture of membranes. Substantiate lobe is called a small extra lobe of placenta, risk of PPH if the lobe is retained. Placenta accreta. Placenta attaches directly to the myometrium. Placenta increta. Placenta invades the myometrium. Placenta percreta. Placenta penetrates through the serosa. May involve the bladder. Most common risk factor for placenta accreta, previous LSES plus placenta previa. Half-burst cells is called macrophages found in the placental villi. Single umbilical artery associated with fetal renal and cardiac anomalies. Prerequisites for forceps, vertex presentation, fully dilated cervix, ruptured membranes, empty bladder. Wrigley's forceps, used for outlet forceps or at the time of LSES. Kylan forceps, used for rotation of the fetal head. Ventose or vacuum contraindication, preterm fetus less than 34 weeks due to risk of intraventricular hemorrhage. Highest risk of Ventose is cephalohematoma. Classical cesarean section is vertical incision in the upper segment carries the highest risk of rupture in future pregnancies. Subscapular liver hematoma, a life-threatening complication of HELLP syndrome. Internal podalic version only indicated for the delivery of the second twin in transverse lie. Most common heart disease in pregnancy in India is rheumatic heart disease, mitral stenosis. Most common cause of heart failure in pregnancy, peripartum cardiomyopathy, usually occurs in the last month or 5 months postpartum. Anticoagulant of choice in pregnancy. Low molecular weight heparin. Warfarin is teratogenic. Causes chondrodysplasia. Best time for cardiac surgery in pregnancy is 16 to 24 weeks. HELP syndrome, hemolysis, elevated liver enzymes, and low platelets. Intrahepatic cholestasis of pregnancy, characterized by pruritus in palms and soles, plus elevated bile acids. Drug of choice for intrahepatic cholestasis of pregnancy is UDCA. Acute fatty liver of pregnancy is characterized by jaundice, plus hypoglycemia in the third trimester. Treatment is immediate delivery. Most common viral hepatitis in pregnancy with highest mortality is hepatitis E. Instruments or maneuver and its primary use. Green Armitage forceps to hold the uterine angles during the LSES. Shirotska needle for cervical cerclage. Simpson forceps, long shaken forceps for low mid cavity use. Frag maneuver, delivery of after coming head and breech. Occiput posterior. Zavanelli maneuver, pushing the head back into the uterus during shoulder dystocia. Non-stress test reactive for 2 acceleration of 15 beat per minute for 15 seconds in 20 minutes. Modified biophysical profile includes NST plus amniotic fluid index. Inverted bottle appearance seen in the cervix during chronic uterine inversion. Hand over hand sign. Characteristics of uterine rupture. Chorioamnionitis. Clinical diagnosis of maternal fever plus fetal tachycardia plus foul smelling like congenital rubella syndrome, triad of cataract, deafness, and heart defects like patent ductus arteriosus. Toxoplasmosis triad includes chorioretinitis, hydrocephalus, and intracranial calcifications. Parvovirus B19 causes hydrops fetalis due to profound fetal anemia. Chickenpox, varicella in pregnancy. Most dangerous if it occurs 5 days before to 2 days after delivery. Maternal mortality ratio. Number of maternal deaths per 1 lakh live births. Prenatal mortality include stillbirths plus yearly neonatal death in first week per 1000 total births. Uterine blood flow at term 500 to 750 ml per minute. Blood volume increase in pregnancy around 40% to 50%. Plasma volume increase 50%. Exceeds RBC mass increase leading to physiological anemia. Naegele's rule is for EDD is called LMP plus 9 months plus 7 days. McDonald's rule, symphysis fundal height in centimeter correlates to weeks of gestation between 20 to 34 weeks. Johnson's formula, a method to estimate fetal weight using SFH and station. Pritchard's regimen for magnesium sulfate is 4 gram IV loading plus 10 gram IM, 5 gram in each buttocks, followed by 5 gram IM every 4 hours. BMI and weight gain. Women with a high BMI greater than 30 should gain only 5 to 9 kg during pregnancy. Quetelet index, another name for body mass index. Corrected mid-parental height used in fetal growth assessment, though more common in pediatrics, it's a favorite integrated question. Postpartum pregnancy. Definition is greater than or equal to 42 weeks from LMP. Most common cause of postpartum wrong dates. Placental sulfatase deficiency is a rare cause of prolonged pregnancy and failure of labor induction. Dysmaturity, Clifford's syndrome, seen in post-mature babies, peeling skin, long nails, loss of vernix. Small for gestational age, birth weight less than 10th percentile. Asymmetric FGR, head sparing effect, usually due to placental insufficiency in the third trimester. Symmetric FGR, head and body both small, usually due to early first trimester insults. Colostrum, deep yellow fluid secreted for the first 2 to 3 days, rich in IgA and lactoferrin. Prolactin, responsible for milk production. Oxytocin, responsible for milk ejection. Lactational amenorrhea method, effective for 6 months if breastfeeding is exclusive and menstruation hasn't returned. Drug of choice to suppress lactation, cabergoline. Preferred over bromocriptine due to fewer side effects. Mastitis, most common causative organism is Staphylococcus aureus. Management of breast abscess, incision and drainage, plus continuous breastfeeding from the unaffected side. Puerperal pyrexia, temperature greater than or equal to 38 degrees Celsius on any two of the first 10 days of postpartum. MTP Act 2021. Legal limit for abortion increased to 24 weeks for specific categories. MTP requirement greater than 20 weeks. Opinion of two registered medical practitioners is required. PCPNDT Act prohibits sex selection before or after conception and regulates prenatal diagnostic techniques. Janani Suraksha Yojana, 100% centrally sponsored scheme to reduce maternal mortality rate and infant mortality rate by promoting institutional delivery. Perinatal mortality rate is late fetal death greater than 28 weeks plus early neonatal death less than 7 days by total births cross 1000. Neonatal mortality rate, deaths within the first 28 days of life per 1000 live births. Cervical ripening agent is dinoproston gel. Misoprostol used for induction, MVA and PPH. Double bubble sign seen in duodenal atresia associated with Down syndrome. Banana and lemon signs, USG signs of spina bifida. Face presentation. Mento anterior is the most common. Mento posterior requires LSES. Brow presentation. Diameter is mento vertical 13.5 cm, the largest and undeliverable vaginally. After coming head diameters, suboccipitobregmatic and suboccipitofrontal. Show is called discharge of mucous plug mixed with blood, sign of impending labor. Lochia rubra, red discharge for the first 1 to 4 days of postpartum. Lochia serosa, pinkish brown discharge for days of 5 to 9. Lochia alba, pale white discharge for 10 to 14 days of postpartum. Sudden collapse plus hemorrhage plus shock out of proportion of blood loss, think inversion of uterus. Sudden respiratory distress plus DIC plus seizures after rupture of membranes, think amniotic fluid embolism. High grade fever plus tender uterus plus foul discharge plus history of interference, think septic abortion. Amenorrhea plus pain plus fainting plus cervical motion tenderness, think ruptured ectopic. Painless bright red bleeding in third trimester, think placenta previa. And just watch the biophysical profile. It includes fetal breathing, fetal movement, fetal tone, amniotic fluid, and NST. Most common chromosomal abnormalities in live birth is trisomy 21, Down syndrome. Most common chromosomal abnormality in spontaneous abortion are autosomal trisomy specifically trisomy 16. Soft marker for Down syndrome on USG increased nuchal translucency, NT greater than 3.5 mm. Absent nasal bone, highly specific marker for Down syndrome in the first trimester. Papain levels in Down syndrome is decreased. Beta HCG levels in Down syndrome increased. Quadruple test components are AFP, beta HCG, UE3 estriol, and inhibin A. Inhibin A in Down syndrome is increased. AFP level in neural tube defects is increased. AFP levels in Down syndrome is decreased. Most common neural tube defect is anencephaly. Lemon sign is called scalloping of the frontal bone seen in spina bifida. Banana sign, curvature of the cerebellum seen in spina bifida. Double bubble sign is seen in duodenal atresia. Keyhole sign is seen in posterior urethral valves in male fetuses. Chorionic villus sampling timing is 10 to 13 weeks. Amniocentesis timing is 15 to 20 weeks. Risk of limb reduction defects associated with chorionic villi sampling done before 10 weeks. Fetal blood sampling cardiocentesis timing is after 18 weeks. Most sensitive Doppler for fetal anemia is middle cerebral artery peak systolic velocity. Non-immune hydrops most common causes cardiovascular anomalies. Immune hydrops most common cause is RH isoimmunization. Mirror syndrome, maternal edema mirroring fetal hydrops. Gastrocysts, paraumbilical defect, usually right-sided with no covering membranes. Omphalocele, midline defect at the umbilicus covered by a membrane, contains liver and bowel. Rocking bottom feet seen in trisomy 18 Edwards syndrome. Polydactyly and cleft lip seen in trisomy 13 Patau syndrome. Holoprosencephaly common in Patau syndrome. Cystic hygroma highly associated with Turner syndrome. Spontaneous closure of VSD is most common heart defect outcome in utero. Fetal echocardiography timing 18 to 22 weeks. Teratogen for Epstein anomaly is lithium. Teratogen for clear cell adenocarcinoma of vagina is diethylstilbestrol. Teratogen for phocomelia thalidomide. Teratogen for neural tube defects valproate. Teratogen for fetal hydantoin syndrome is phenytoin. Warfarin embryopathy characterized by nasal hypoplasia and stippled epiphysis. ACE inhibitors in pregnancy cause fetal renal tubular dysgenesis and oligohydramnios. Isotretinoin, highly teratogenic, causes craniofacial and cardiac defects. Alcohol in pregnancy, most common preventable cause of mental retardation. Smoking in pregnancy associated with placental abruption and IUGR. Radiation safe limit in pregnancy less than 5 rad. Ductus arteriosus closure functionally closes within 10 to 15 hours of birth. Ligamentum venosum, remnant of the ductus venosus. Ligamentum teres, remnant of the umbilical vein. Fetal breathing movements detachable by USG from 11 weeks. Primary source of amniotic fluid, yearly period, maternal serum, amniotic epithelium. Primary source of amniotic fluid in late periods, fetal urine. Potter syndrome, renal agenesis, oligohydramnios, pulmonary hypoplasia. Spalding sign is called overlapping of skull bones, which indicates intrauterine fetal death. Uterine weight at term increases from 60 gram to 1000 gram. Uterine blood flow at term 500 to 750 ml per minute. Physiological anemia due to plasma volume increasing more than RBC mass. Cardiac output increases by 40%, peaking at 28 to 32 weeks. Position for maximum cardiac output, left lateral position. Supine hypotension syndrome due to compression of the inferior vena cava. GFR in pregnancy increases by 50%. Renal glycosuria, common in pregnancy due to lowered the renal threshold for glucose. Hydroureter in pregnancy, more common on the right side due to dextrorotation of the uterus. Respiratory change in pregnancy, tidal volume increases but functional residual capacity decreases. Coagulation state, pregnancy is hypercoagulable state, fibrinogen increases. Clotting factors that do not increase, factors 11 and 13. Alkaline phosphatase levels double in pregnancy produced by the placenta. Serum albumin decreases in pregnancy. Beta-HCG source is syncytiotropoblast. Beta-HCG peak at 8 to 10 weeks. Beta-HCG disappears after delivery within 2 weeks. Human placental lactogen antagonizes insulin, ensuring glucose for the fetus. Progesterone source before 8 weeks is corpus luteum. Progesterone source after 10 weeks is placenta. Relaxin softens pelvic ligaments and ripen the cervix. Linea nigra, dark vertical line on the abdomen due to melanocyte stimulating hormone. Cloasma, melasma is called mask of pregnancy. Spider angiomata due to high estrogen levels. Palmar erythema, also an estrogen effect. Braxton Hicks contraction is painless, irregular contractions not associated with cervical changes. Goodell sign is softening of the cervix. Ladinus sign, softening of the anterior midline of the uterus at the junction with the cervix. Haga sign, softening of the lower uterine segment. Chadwick's or Jacquemus sign is bluish discoloration of the vagina. Osiander sign, pulsation felt in the lateral vaginal fornices. Piscasac sign, asymmetrical enlargement of the uterus due to implantation in the corner. Montgomery tubercles, enlarged sebaceous glands on the areola. Secondary areola, pigmentation extending beyond the primary areola. Internal ballotment performed at 16 to 28 weeks. Quickening at primi around 18 to 20 weeks. Quickening in multi around 16 to 18 weeks. Fetal heart sounds heard from 18 to 20 weeks. Fetal heart sounds in Doppler heard from 10 to 12 weeks. Nipple stimulation can cause oxytocin release and uterine contractions. Average length of cervix is 3 to 4 cm. Funneling of cervix, signs of cervical incompetence. Lower uterine segment is formed from the isthmus. Vulture's position increases the conjugate diameter of the inlet. Obstetric conjugate, the shortest antero-posterior diameter of the inlet. Diagonal conjugate, the only AP diameter that can be measured clinically. Ischial spines, landmark for station and pudendal block. Bituberous diameter is diameter of the pelvic outlet. Platypelloid pelvis, flat pelvis with a wide transverse diameter. Android pelvis, heart-shaped inlet associated with deep transverse arrest. Most common congenital infection is cytomegalovirus. CMV USG finding is periventricular calcification and microcephaly. Congenital toxoplasmosis triad include chorioretinitis, hydrocephalus, and intracranial calcification, which is diffuse. Congenital rubella syndrome triad includes cataract, sensory neural deafness, and heart defects like patent ductus arteriosus. Congenital syphilis sign includes Hutchinson teeth, mulberry molars, and sebrations. Syphilis screening, BDRL or RPR non-specific. Confirmatory is FDA ABS. Parvovirus B19 complications include hydrops fetalis due to aplastic anemia, chickenpox, timing, highest risk of congenital varicella syndrome if maternal infection occurs between 8 to 20 weeks. Neonatal varicella, most dangerous if mother gets rash 5 days before 2, 2 days after delivery. Zika virus, strongly associated with severe microcephaly. Malaria in pregnancy, associated with placental insufficiency and severe maternal anemia. Drug of choice for malaria in pregnancy in India is chloroquine, if sensitive, or artesunate for falciparum. HIV vertical transmission, most common during labor and delivery intrapartum. Prevention of HIV transmission is hard for the mother, less nevirapine or zidovudin for the baby. Breastfeeding in HIV in India, exclusive breastfeeding is recommended if replacement feeding is not affordable, feasible, acceptable, sustainable, and safe. Hepatitis B transmission, highest risk if mother is HBeAg positive. Neonatal hepatitis B prevention, hepatitis B vaccine plus Hep B immunoglobulin within 12 hours of birth. Listeriosis associated with granulomatosis infantiseptica in the neonate. Bacterial vaginosis associated with preterm labor and premature rupture of membranes. Whiff test, fishy odor and adding 10% KOH to vaginal discharge. It is seen in bacterial vaginosis. Strawberry cervix characteristics of trichomoniasis. Clue cell is vaginal epithelial cells coated with bacteria which is seen in bacterial vaginosis. Candidiasis, curdy white discharge, pH less than 4.5. Gonorrhea, most common cause of ophthalmia neonatorum within 2 to 5 days. Chlamydia, most common cause of neonatal conjunctivitis after 5 to 14 days, and pneumonia. Most common medical disorder in pregnancy is anemia. Anemia definition by WHO is hemoglobin less than 11 gram per deciliter in pregnancy. Parenteral iron indicated if oral iron is not tolerated or in cases of severe anemia at 30 to 34 weeks. Heart disease, NIHA class 3 and 4 are contraindications of pregnancy. Mitral stenosis, the most common rheumatic heart lesion in pregnancy. Labor in heart disease, second stage should be shortened using forceps or ventouse. Infective endocarditis prophylaxis, no longer routinely recommended for uncomplicated vaginal delivery. Postpartum heart failure usually occurs in the first 24 to 48 hours due to fluid shift. Peripartum cardiomyopathy is heart failure occurring in the last month of pregnancy are up to 5 months of postpartum. SLE in pregnancy associated with congenital heart block in the fetus due to anti-Ro anti-SSA antibodies. Antiphospholipid syndrome, leading cause of recurrent pregnancy loss, treated with aspirin plus heparin. Epilepsy in pregnancy, risk of fetal hydantoin syndrome with phenytoin. Folic acid dose for epilepticus 4 mg or 5 mg daily, higher than the standard of 0.5 mg. Gestational diabetes screening is DIPSI is the gold standard in India, which is 75 gram OGTT. GDM diagnosis DIPSI second hour blood sugar greater than or equal to 140 milligram per deciliter. White's classification used for pre-gestational diabetes. Most common fetal anomaly in a diabetic mothers or cardiac anomalies, which is specifically VSD. Most specific fetal anomaly in diabetic mothers, caudal regression syndrome, which is called sacral agenesis. Intrahepatic cholestasis is pruritus was at night plus elevated serum bile acids delivery at 37 weeks. Acute fatty liver of pregnancy characterized by jaundice plus hypoglycemia plus DIC requires immediate delivery. Appendicitis in pregnancy, the most common non-obstetric surgical emergency. Appendicitis pain moves upwards and laterally as the uterus grows, which is called Alder sign. Cholecystitis, second most common surgical emergencies. High estrogen increases gallstone risk. Thromboembolism, pregnancy increases risk fivefold, highest risk in the postpartum period. Warfarin versus heparin. Warfarin is teratogenic. Heparin, low molecular weight. Heparin does not cross the placenta. Placental and clinical signs table. Signs and its meaning. Bandel's ring, which is called pathological retraction ring. It indicates impending rupture of uterus. Hand over hand sign, feeling fetal parts easily under maternal skin, which indicates uterine rupture. Stalworthy sign, fetal heart rate drop on pressing head, low lying present placenta. Turtle sign, head retracts against perineum. Shoulder dystocia. Skull's mechanism, placenta delivers with fetal side first. Center separates first. Matthews Duncan, placenta delivers with maternal side first. Margin separates first. Bishop score less than 6 indicates an unfavorable cervix needs ripening PGE2, which is called dinoprostol gel. Misoprostol is also known as PGE1. Dose for PPH is 800 microgram, sublingual or rectal. Misoprostol dose for induction is 25 microgram 6th hourly. Methyl ergometrine dose is 0.2 milligram IM, contraindicated in hypertension. Carboprust, which is called PGF2 alpha, dose is 250 micrograms IM, contraindicated in asthma. Tranexamic acid given within 3 hours of PPH answered for best results. B-Lynch sutures is used for compression suture used for atonic PPH. Internal iliac artery ligation. Anterior division is ligated to control pelvic hemorrhage. Active management of third stage, which includes uterotonic within 1 minute plus controlled cord traction plus fundal massage. Delayed cord clamping 1 to 3 minutes after birth prevent neonatal anemia. Apgar score measured at 1 minute and 5 minutes. Apgar components includes appearance, pulse, grimace, activity and respiration. Neonatal resuscitation start positive pressure ventilation if heart rate less than 100 beat per minute. Chest compressions in neonates start if heart rate less than 60 beat per minute despite effective positive pressure ventilation. Meconium aspiration. Protein suctioning is no longer recommended for vigorous babies. Vitamin K for neonates 1 mg IM to prevent hemorrhagic disease of the newborn. Episiotomy repair done in 3 layers: vaginal mucosa, perineal muscles, and skin. Forceps with ventouse. Forceps have a higher risk of maternal trauma. Ventouse has a higher risk of fetal trauma, like cephalohematoma. Prague maneuver for delivering after coming head and breech, occiput posterior. Burns Marshall maneuver for delivering after coming head and breech, occiput anterior. Pinart's maneuver to bring down a leg in an extended breech. Lausette maneuver to deliver the arms in a breech. Zavanelli maneuver replacing the head back in the uterus for emergency LCS for shoulder dystocia. Macrobus maneuver hyperflexion of the maternal hips, first line for shoulder dystocia. Rubin maneuver pressure on the posterior shoulder to rotate it. Wood's corkscrew maneuver, which is rotating the posterior shoulder 180 degrees. Cervical circlage McDonald, which is simple purse string suture at the cervico-vaginal junction. Cervical circlage Shirodkar is submucosal suture near the internal os. Primary PPH within 24 hours of delivery. Secondary PPH is 24 hours to 6 to 12 weeks of postpartum. Most common cause is retained products of conception. Sheegan's syndrome is pituitary necrosis after massive PPH leads to failure to lactate and amenorrhea. Asherman syndrome, intrauterine adhesions often after overzealous curettage. Uterine inversion indicates immediate management is manual replacement, which is called Johnson's maneuver. Hydrops fetalis, fluid in greater than or equal to 2 fetal compartments like ascites, pleural effusion, pericardial effusion, skin edema. AFI Peelan's method, some of the deepest vertical pockets in 4 quadrants. Modified biophysical profile is NST plus AFI. Inverted bottle sign, chronic uterine inversion. Bandle string location, junction of the upper and lower uterine segments. Crowning occurs when the biparietal diameter stretches the vulva. Cervical dilatation in primigravida 1 cm per hour in active phase. Cervical dilatation in multigravida 1.2 to 1.5 cm per hour. Engagement in primi usually occurs 2 weeks before labor. Engagement in multi occurs at the onset of labor. Denominator for face mentum. Denominator for bro, frentum or glabella. Denominator for breech is sacrum. External cephalic version best done at 36 weeks in nullipara or 37 weeks in multipara. Aspiration pneumonia, which is also called Mendelssohn syndrome, risk during general anesthesia in pregnancy. Prophylactic ergometrine avoided in the second twin to prevent uterine contraction before delivery. The golden hour, the first hour of life, critical for skin to skin contact and breastfeeding initiation. Complete mole karyotype is most commonly 46XX. Partial mole karyotype mostly 69XXY. Triploid, 2 paternal and 1 maternal. Hutchmole clinical triad include painless bleeding plus uterus larger than dates plus very high beta HCG. Theca lutein cyst, multilocular ovarian cyst seen in gestational trophoblastic disease due to massive beta HCG stimulation. Complete mole USG shows snowstorm appearance or bunch of grapes. Partial mole in USG, Swiss cheese appearance of the placenta plus fetal parts may be present. Management of Hutchmole, suction and evacuation is the gold standard. Follow up in GTD, weekly beta HCG until 3 consecutive negatives, then monthly for 6 months. Carcinoma characterized by yearly hematogenous spread, especially to the lungs. Placental site trophoblastic tumor produces low beta HCG but high human placental lactogen. Treatment of placental site trophoblastic tumor is hysterectomy. GTN scoring used to classify into low risk, score less than 7 and high risk greater than or equal to 7. Low risk GTN drug of choice is methotrexate. High risk GTN drug of choice is EMA co-regimen. Amniotic fluid embolism, sudden collapse, DIC, and respiratory distress management is supportive. Cervical pregnancy characterized by hourglass uterus on USG. Abdominal pregnancy, failure of oxytocin to induce labor, fetal parts felt extremely easily. Aries-Stella reaction, hypersecretory change in the endometrium seen in ectopic pregnancy. Hoffman's exercises recommended for inverted nipples in the late pregnancy. Skill dual bodies, pathognomen for yolk sac tumors, Kallman syndrome, primary amenorrhea plus anosmia, Swyer syndrome, 46XY with streak gonads and female phenotype, prune belly syndrome associated with oligohydramnios and urinary tract dilation. Fetal warfarin syndrome includes nasal hypoplasia and stippled epiphysis. Leutenbecker syndrome, which includes mitral stenosis plus atrial septal defect in pregnancy. Eisenmenger syndrome, highest mortality risk in pregnancy, approximately 50%. Termination is advised. Fontan procedure patients can tolerate pregnancy if ventricular function is good. Velamentous insertion associated with vasa previa and single umbilical artery. Placental extracoriolis includes placenta circumvallata and circummarginata. Placenta circumvallata associated with increased risk of antepartum hemorrhage and preterm labor. Total body water increase 6.5 to 8.5 liters by term. Maternal TSH decreases in the first trimester due to HCG's weak thyroid stimulating effect. Pelvic inlet shape, transverse diameter is the widest in a gynecoid pelvis. Engagement occurs when the biparietal diameter passes the inlet. Suboccipitophragmatic, the presenting diameter in a well-flexed vertex. Suboccipitofrontal, presenting diameter in an incompletely flexed vertex. Occipitofrontal, presenting diameter in a deflexed head. Mentovertical, largest diameter seen in bro presentation. Submentobrachmatic, presenting diameter in a face presentation. Bitrochanteric, presenting diameter in breech. Pritchard criteria for magnesium sulfate toxicity. Respiratory rate less than 12 per minute. Urine output less than 30 ml per hour. Loss of patellar reflex. Total dose of magnesium sulfate in Pritchard regimen 30 gram in the first 24 hours. Duration of second stage in primary 2 hours, 3 hours with epidural. Duration of second stage in multi 1 hour. Active management of third stage reduces risk of postpartum hemorrhage by 60%. Bugry balloon. Intrauterine tamponade device holds up to 500 ml of saline. Modified B. Lynch or Heyman suture does not require opening the uterus. Stepwise devascularization, uterine artery, ovarian artery, internal iliac artery. Post-delivery, uterine involution, uterus become a pelvic organ by the 12th day. Involution complete by 6 weeks. End of puerperium. Cervical opening closes to 1 finger tip by the end of the first week. Lochia duration. Rubra first 1 to 4 days. Serosa 5 to 9 days. Alba 10 to 14 days. Menstruation in non-lactating mothers return in 6 to 8 weeks. Ovulation in non-lactating mothers can occur as early as 4 weeks. Mastitis timing most common in the second and fourth week of lactation. Cracked nipples major portal of entry for Staphylococcus aureus causing mastitis. Bishop score 9 very high chance of successful vaginal delivery. Modified Bishop score includes only dilation, effacement and station. Induction failure defined if no irregular contractions after 12 to 18 hours of oxytocin. Cord pH less than 7 is the cutoff for pathological acidemia. Drug of choice for vulvovaginal candidiasis is fluconazole, single 150 mg dose. Drug of choice for bacterial vaginosis is metronidazole. Drug of choice for trichomoniasis is metronidazole. Treat partner 2. Drug of choice for GBS prophylaxis is penicillin G. Drug of choice for toxoplasmosis is spiramycin or trimethamine plus sulfadicin. Drug of choice for herpes simplex is acyclovir. Drug of choice for scabies in pregnancy is permethrin 5% cream. Anti-D dose for Clear Bedicate is 10 microgram for every 1 ml of fetal blood in maternal circulation. Standard anti-D dose is 300 microgram. Cervical length less than 25 mm indicates high risk of preterm delivery. Fetal fibronectin, high negative predictive value for preterm labor. Amnitio test detects PAMG1 to confirm rupture of membrane. Fern test microscopic arborization of dried cervical mucus. Spin bucket effect elasticity of cervical mucus maximum at ovulation. Friedman's curve traditional labor progress chart. Latent phase duration less than 20 hours in primary, less than 14 hours in multi. Secondary arrest of dilatation is no change for 2 hours in active phase. Failure of descent, no change in station for 1 hour in second stage. Precipitate labor is total duration of labor less than 3 hours. Ridgeon maneuver done to deliver the head by extension. Episiotomy indication, rigid perineum, instrumental delivery or breech. First degree perineal tear, only skin and vaginal mucosa. Second degree perineal tear involves perineal muscles but not the sphincter. Third degree perineal tear involves the anal sphincter, internal or external. Fourth degree perineal tear involves the rectal mucosa. Secondary PPH timing is most common between 8 to 14 days. Puerperal psychosis occurs in 1 in 1000 deliveries, which is emergency. Postpartum blues occurs in 50 to 80% of mothers resolves by day 10. Postpartum depression occurs in 10 to 15% within 4 weeks. Maternal death, death within 42 days of termination of pregnancy. Late maternal death, death between 42 days and 1 year. Direct maternal death due to obstetric complications, example PPH. Indirect maternal death due to pre-existing disease aggravated by pregnancy, example anemia. Infant mortality rate, death less than 1 year per 1000 live birth. Stillbirth means death of fetus greater than 28 weeks in India or 500 gram. Perinatal mortality, stillbirth plus early neonatal death. Ovular uterus associated with concealed abruptio placenta. Double set of examination only done for suspected placenta previa in the OT. Golden period for anti-D is within 72 hours, can be given up to 14 to 28 days. Let's wrap up the session. Tomorrow we'll continue gynecology one-liners. Thank you guys. Keep supporting. Like, share and subscribe MedFlash for upcoming videos.